Hello there, classmates. This is Cassandra Sensenig. I chose to do my complementary and integrative health modality presentation on hand-mediated biofield therapy of Reiki. History and origin. It was first practiced by Buddha, originated in Tibet 2,500 years ago. It was developed and rediscovered in the mid to late 1800s by a Japanese scholar of religion, Dr. Mikao Usui. A student had questioned him, how did Jesus facilitate the healing miracles that he performed? He was intrigued by this idea about how Christ can heal with his hands, and he was determined to answer that question for the student. Some energy came to him while he was on this 21-day retreat that he chose to do during a deep meditation. He began then practicing Reiki, starting a clinic in 1922. He passed on his techniques to several other masters, and they're included here. What is Reiki? So Reiki means universal life energy. It's spiritual, vibrational healing. There's no touch or light, subtle, gentle touch of hands on the body, allowing a flow of energy from a limitless source to the patient. So hands, for the most part, are still during the treatment, but they do move to change hand placement. Healing uses energy to balance body, mind, and spirit. It's safe, natural, non-intrusive. Most patients are fully clothed during a therapy session, calming and reassuring. It's not a cure, but it helps facilitate healing. It's a complement to traditional medicine, really shouldn't be used by itself, and it's beginning to be practiced in many hospitals and medical settings. So here on this slide, I'm not going to go over this slide in detail. This is about how does Reiki healing energy work. There's something called chakras, which are different areas in or on our body where energy enters and leaves our body. No chakra works independently, and each plays a vital role in balancing and harmonizing our soul and every aspect of our life. So there's 7 main chakras or 7 main areas in our body where hands can be placed during Reiki, where energy can be used for all these different areas. So if you want to pause the video, you're more than happy to, and just kind of read through these different areas and how they can help. Medical conditions and Reiki treats conditions on a physical, mental, emotional, and spiritual level. It's a great tool for stress reduction and relaxation. Some use it to strengthen wellness, but some also use it to help with symptoms of disease or illness. Helps with imbalances or situations that occur in many of our lives. For example, emotional, physical trauma. For example, beyond that, some post-traumatic stress disorder. Injury or illness, acute or chronic, so you have asthma, headaches, that kind of thing. Negative thoughts and feelings, so anxiety, fear, depression, worry, etc. Nutritional depletion, destructive lifestyle and relationships, lack of care for self, so negative talk, lack of love for oneself, some depression stuff there, substance abuse. Benefits of Reiki. So it helps the body to release stress and toxins, increases self-healing ability, improves sleep, decreases blood pressure, helps with acute and chronic illness, pain relief, reduces side effects of medications, supports immune system, improves spiritual growth and emotional stability, and adjusts energy flow, brings body into balance and harmony. So I've included here in my presentation a video on what is Reiki energy and how does Reiki work. This video is super helpful for me to understand exactly what Reiki is, so I hope you like it.
To some people, Reiki is mysterious, foreign, or just plain made up. But let me ask you something. When you experience pain, what do you do? The reality is, we all naturally perform the fundamental essence of Reiki on pretty much a daily basis. It's inherent, instinctive. It's innate within all of us. When you have a headache, where do your hands go? You cradle your head with your hands, right? When you hurt yourself, where do your hands go? You grasp that area with your hands, and you keep them there until the pain eases up, right? And when your tummy hurts, where do your hands go? You soothe your tummy with your hands. How about with others? A little one comes to you and shows you where they hurt. What do? You place your hands on the area that hurts. You might even embrace them while you have your hands over their hurt. You kiss their boo-boo and make it all better. Why do you do this? What is it that you're doing? Our bodies are made up of energy. We exist in a universe of energy. When we use our hands to comfort her, we are transferring and focusing energy. But the use of hand placements goes beyond hurt. What about an expectant mother caressing her tummy? A couple holding hands. A handshake. A pat on the back. We all like that pat on the back, right? In a nutshell, that is the essence of Reiki. Reiki is a transfer of the highest healing energies from one being to another. Reiki amplifies and intensifies the power of touch. It promotes balance and harmony in your spirit, mind, and body. Reiki is a natural, simple, and powerful practice anyone can learn to help themselves, anyone of any age, at any time. Experience the power of touch. Tap into and empower your life force energy. Peace.
So as you look over these above benefits, what conditions on the unit you work or medical conditions that you're currently battling yourself would or could benefit from Reiki and why, or your children or whatever? Do you believe that something as simple as light touch can make such a large impact on health? And have you ever had the experience of Reiki? So age and contraindications. Reiki is for everyone. Heals elderly, adults, children, toddlers, babies, and even pets. Some contraindications are not big ones, but has not been shown to have specific contraindications or harmful effects. It should not be used in replacement of seeing a primary care provider for a health problem or an illness. There's certain medical diagnoses that I've read in one of my resources that said to shy away from: diabetes, high and low blood pressure, heart, or specifically people with pacemakers, thyroid problems, mental illness, epilepsy in women, and first trimester of pregnancy. Some side effects of Reiki: some feel energy flow during sessions, so they get the sensation of heat or cold in their hands, tingling in parts of their body, kind of feeling sleepy, lightheaded, this, quote, floating experience. May feel more emotionally vulnerable, sadness or anxiety during treatment due to the increased energy. Some advantages and disadvantages of Reiki. Let's start with advantages: stress and reduction, relaxation. Balances mind and emotions, speeds up recovery from surgeries, illness, helps to heal someone physically, emotionally, spiritually, and mentally. Use of practitioners and self-treatment, accelerates and strengthens the healing process, and can be used for wellness as well as illness. Some disadvantages: there's no formal regulation. It's not really regulated in the United States. Practitioners receive no certification or licensing to perform this therapy. Limited scientific support, and there's little research. There's little scientific proof that can explain this healing art. Limited insurance coverage. Some will if being used to relieve pain or symptoms from a serious illness, but for elective for wellness, typically not covered or is limited in the coverage, and individual variation. So treatments can vary very widely among each individual, from one individual to another. How is Reiki perceived in the general population? It's being used in major clinics and hospitals, so increasing in popularity. Doctors, dentists, nurses, and other professionals have been trained in some facilities. Practitioners that perform Reiki are most interested in seeing if symptoms improve after treatment. Canada is opposed to complementary and alternative medicine, therefore they're trying to put a stop to the initiation of such therapies like Reiki, but the United States, on the other hand, is using complementary and alternative medicine, or Reiki, in many of their medical facilities, and there's an increased demand for it. Reiki sessions ideally last 60 to 90 minutes. It seems as though we have limited time with our patients now as it is, so how can we incorporate some of these practices in the care that we provide in the time that we do have? Do you have any interest in learning Reiki and being able to promote this for your patients or yourself or your family members? Recent or current research. There's very little high-quality research completed on Reiki. United States has the National Center for Complementary and Alternative Medicine. Back in 2004, there were some clinical trials that were used to evaluate efficacy of Reiki, specifically fibromyalgia, neuropathy, prostate cancer, and advanced AIDS. There's not any current clinical trials being done, according to the National Center for Complementary and Alternative Medicine. Our textbook does talk about some systemic reviews that were done on Reiki, and I'll just touch on one of them. There was a randomized control trial done back in 2012 with returning military personnel suffering from post-traumatic stress disorder, found that Reiki with guided imagery significantly reduced post-traumatic stress disorder symptoms and showed significant improvement in mental quality of life. So there has been some research out there and some good results, but it's very limited. Educational requirements. They're responsible for a series of attunements. Attunements are sessions with Reiki masters that teach the basic methods of energy healing. There's two different levels of education for Reiki. The first level, they learn the skill within a weekend workshop. The second level can still be done within a weekend workshop, but they learn how to be a master and a teacher of the therapy. The second level, or the second degree, includes learning how to do distant healing and further enhancement of one's physical, mental, emotional, and spiritual healing abilities. The master degree, the second level, involves training, mentorship with a master Reiki practitioner, and through Reiki sharing and Reiki practice groups, or both. It's a certification, it's not a formal process, and masters, second level people approve first level students. In conclusion here, I found 5 principles of Reiki, and it's just kind of something that we can just take with us each day. And it says, just for today I will give thanks for my many blessings. Just for today I will not worry. Just for today I will not be angry. Just for today I will do my work honestly. Just for today I will be kind to my neighbor and all living things. Reiki produces a sense of well-being and relaxation in both the nurse and the recipient. So I think we can read over these principles of Reiki and use them as a guide, as we enter each day with the care that we provide for our patients, and self-care for ourselves. I hope you enjoyed this presentation on Reiki. Here are my references if you're interested in looking anything else up additional about Reiki. I hope you enjoyed it. Have a great week. Thanks.